Action.
Yes.
Hello, Jackie. My name is Jenny. I'm going to be your student nurse today. How are you feeling? Need some privacy.
I'm okay.
Okay, so can you tell me why you're in the hospital today?
I have been having some headaches for the past 2 weeks. I'm not sure why.
Okay. Can you confirm your full name and date of birth for me?
Yes, Jacqueline Alvarez, January 8th, 1972.
Do you have any allergies?
No.
Okay. Can you tell me, do you know where you're at right now?
In the hospital?
Okay. Do you know what day it is?
Today's Thursday.
Okay. And then can you tell me who the president is?
Donald Trump.
Okay. All right. So, the patient's mood and well-being overall is, and her demeanor is normal, and appropriate. The patient is alert-oriented times 3. Jackie, are you having any pain?
Right now, you mean?
Yeah.
No, not right now.
Okay, but you said you came in for headaches.
Yes.
Okay, so can you tell me when was the last time you had a headache?
Probably about 2 hours ago.
Okay, when did you see that these headaches started to occur?
Like I said, about 2 weeks ago.
Okay.
I think I've been working longer hours.
Okay. Does your headache stay in the same spot or does it radiate?
They stay in the same spot.
Okay.
Most part.
Can you describe it to me? Is it like a throbbing pain? Is it is it sharp?
I would say it's a lingering
Okay.
pain.
Okay, so it's constant and it's like for how long do these headaches come and go?
I wouldn't be able to tell you exactly how long they come and go. I've been taking Advil.
Okay.
Whenever I feel the pain, I just take the Advil basically every 4 or 5 hours.
Okay, so on a scale from 0 to 10, can you tell me how bad the pain is?
I would say 6.
Okay. Can you tell me if there's any, you told me the relieving factors, which you said were the Advil. Can you tell me if there's any aggravating factors, anything that makes it worse?
I wear reading glasses. I started wearing reading glasses, and so I feel that aggravates it.
Okay. So, Jackie, today I'm going to be doing a full body assessment on you, so do you consent to do that?
Yes.
Okay. So, first I'm going to start off at the head. I'm going to assess the patient's hair for that it's well distributed, and I'm going to check for any bumps, any lumps, any skin problems. I'm checking the patient's cranial nerves. So cranial nerve number 1 is the olfactory. Jackie, can you close your eyes, clench your teeth, and then close one nostril for me? Okay. Can you smell that? What is it?
It smells like mint.
Okay, close your other nostril. What does it smell like?
Mint.
Okay, and then let go of your nostril. What does it smell like?
Mint.
Okay, good job. You can open your eyes now. So I'm going to check for the second cranial nerve, which is the optic nerve. We're going to use the Rosenbaum chart. Jackie, can you sit up for me? Okay, so I'm going to put it 14 inches from your face. You're going to cover your left eye, and then you're going to read starting from the top until you can't anymore.
Okay. 95874 2843 638.
Okay.
A little blurry.
So the patient has 20/70 vision on her right eye. You're gonna do the same for me with the left eye now, Jackie.
Okay. All right. 95874 2843 638 EWE X00. Just it's a little blurry.
Okay. The patient has 20/70 vision on the right eye as well. You're gonna read the same chart starting from the top with both eyes now, Jackie.
Okay. 95874 2843 638 EWE X00 8745 EMW
Okay, so the patient has 20/50 vision with both eyes. Okay, so the optic nerve is done. We're gonna go on to the cranial nerve number 3. You can lay back down, Jackie. So we're gonna check for Perla, and I'm just gonna shine this light in your eye, okay?
Okay.
Okay, the patient's eyes constrict when light is shown, or dilate. Okay. So we're gonna check for cranial nerve number 4, which is the trochlea. You're just gonna follow my pen. Okay, we're gonna check for cranial nerve 6, which is abducens. Follow my pen. We're gonna check for cranial nerve 5, which is the trigeminal nerve. So you're gonna close your eyes, clench your teeth, and then you're gonna tell me yes whenever you feel something, okay?
Yes. Yes. Yes.
Okay. We're gonna check for cranial nerve number 7. You can open your eyes, Jackie. Can you smile for me? Frown. Okay, can you raise your eyebrows? Okay, can you puff out your cheeks? Okay, close your eyes. I'm gonna check for cranial nerve number 8, vestibulocochlear. Can you hear this?
Yes. 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 Yes.
Okay, good job. You can open your eyes now. Checking for cranial nerves 9, 10, and 12. Can you stick your tongue out for me? Say ah.
Ah.
Move it up and down. Move it side to side. Move it around. Okay, swallow. Okay, good job. So now you're going to sit up. And then you're going to shrug your shoulders. Okay, checking for cranial nerve number 12. That's the 11, that's the accessory. Okay, now you're going to move your head up, down, side to side, and then you're going to tilt it side to side. Okay, good job. You can lay down. So I'm checking the face for symmetry. The nose is symmetrical to the rest of the face. The patient's skin it looks well hydrated. It looks normal. There's no signs of flushing. The patient's mouth is properly hydrated. Can you open your mouth for me? Let me see your gums. Okay. There's no signs of bleeding or any abnormalities. The patient does not have any drainage from the ears, nose, mouth, or eyes. There's no redness in the eyes. There's no signs of cyanosis. So now we're gonna go check the lymph nodes. So I'm just gonna touch your lymph nodes, okay? Preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, then supraclavicular. So the lymph nodes are non-palpable and non-tender. So I'm going to check that the trachea is at the midline. I'm making sure that the thyroid cannot be seen. There's no signs of a goiter. Okay? I'm going to check the patient's chest now. So we're going to start with the 6 anterior lung sounds. So I'm going to auscultate the lung sounds. Lateral sounds, and then the 8 posterior lung fields. The vitals were already taken. Her blood pressure, her temperature, her pulse, and her respiratory rate were all taken previously, and all the findings were normal. Now I'm going to auscultate the patient's heart sounds for any adventitious sounds. So first I'm going to listen to the right second intercostal space, which is the aortic. Then I'm going to check the left, which is the left second intercostal space, which is the pulmonic. The third intercostal space on the left, which is the Erb's. Fourth intercostal space on the left is the tricuspid, and the fifth intercostal space on the left is the mitral apical pulse. The way that I assess that is the patient's gonna move forward so that the heart comes forward, and then I'll auscultate her for a full minute and assess the rate and rhythm of the heart. I assess the patient's chest for symmetry, the skin for overall well-being. There's no signs of dehydration and skin turgor. There's no tenting, and there's no abnormalities or anything like that. I'm going to check the patient's carotid pulse, but bilaterally, but not simultaneously. So I'm going to check it one at a time, and then I'm going to also check it with a radial pulse to compare them. Okay? Okay, perfect. And then, Jackie, can you turn your head to the left? Okay, so there's no signs of jugular vein distension, and there's no flattened neck veins. To the right, Jackie, please. Again, no signs of JVD or flattened neck veins. You can face forward again. You can look up again, Jackie. Okay. So the radial pulse is intact. I checked for skin turgor. There's no signs of dehydration. The skin is properly hydrated. There's no signs of any abnormalities found. I'm gonna check the deep tendon reflex for the bicep, the tricep, and the brachioradialis. Jackie, can you please sit up for me? Just stay right there. Yeah. Okay, so, or you can put your feet over if you want. Okay, so I'm gonna ask you to just let your arm hang and let all the weight fall on me, okay?
Okay.
So we're checking for the tricep. Okay, we're gonna check for bicep now. Just let it hang. And then brachioradialis. And do the same on the left arm. So while I'm here, I'm just gonna go ahead and check the patellar deep tendon reflex. Okay, thank you, Jackie. I'm gonna ask you to stand up so I can do a test. So you're gonna stand with your hands by your side, feet together, close your eyes. Okay, patient's balance and gait is intact. The patient does not seem to be swaying. Open your eyes, and then you're just gonna walk in a straight line for me. Okay, and then walk back. Patient's ambulance is intact and ambulating properly. You can sit back down, Jackie. Okay, so you can lay back down because I'm gonna assess your abdomen now. Okay, so first I'm just gonna inspect the patient's abdomen. By inspection, there doesn't seem to be any abnormalities other than a little bit of distension in the left lower quadrant. And so, Jackie, when was your last bowel movement?
2 days ago.
Okay, do you have any pain?
Little discomfort.
Okay. First I'm going to auscultate each quadrant for 1 minute. So I'm gonna auscultate the right lower. For 1 minute, I need to hear 5 to 35 gurgles. Same in the right upper, same in the left upper, and same in the left lower. In the left lower, I hear hypoactive vowel sounds. Okay, now I'm going to percuss. So I should hear dull. Okay? Tympanic here. Okay, it's very dull on the left lower, which means there could be some type of obstruction. The patient hasn't used the restroom hasn't gone to the bathroom or in 2 days. Jackie, I'm gonna palpate in each quadrant. You're gonna tell me if you feel any pain.
No. Yes.
Okay, the patient feels pain on the left lower quadrant. Now I'm gonna assess the lower extremities. Overall, the skin is all intact. There's no lesions. There's no ulcers. There's no skin problems. I'm gonna check the popliteal pulse. So Jackie, can you just bend your leg for me? Right there. Okay, and then I'm gonna check the pedal pulses bilaterally. Okay. I'm gonna check to make sure that there's even hair distribution on the legs to evidence tissue perfusion. I'm going to check the capillary refill on each of the toes and each of the fingers. It is brisk, meaning that there's no problems with blood perfusion. There's no signs of edema on each of the legs, on either of the legs. Overall, the patient's well-being is intact. There seems to be problems with headaches and with constipation. So I'll document that and let the doctor know. Thank you, Professor Lino. I love you.